Preeclampsia is a condition that can occur in pregnant women over 20 weeks of pregnancy and in the early postnatal period. It's thought to develop from a disruption in the placenta, and there's ongoing research in this area. But this condition can be quite serious and can lead to a condition called eclampsia, which involves having a seizure. So the symptoms of preeclampsia include raised blood pressure and protein in your urine. It can also include epigastric pain, which is pain below your breast line towards the left where your liver is. It can also involve edema, which is swelling in your face, your hands, your feet. And it can also include having a headache and some visual disturbances. And I'll go through each one of these and explain why this happens. So during pregnancy, at each appointment, your midwife will check your blood pressure, and this is to see if there's any elevation in the readings. So if your blood pressure starts to become higher than normal and starts to become abnormal, then this could be a potential sign of preeclampsia. At each appointment as well, your midwife will test your urine, and what they're looking for, amongst other things, is protein. And this is because if you've got high blood pressure, your blood vessels can lose their tone, and this can make protein leak from your cells. So the protein would then be excreted in your urine when it isn't normally like this. So as well as having a higher blood pressure and possible protein in your urine, you can also experience some swelling in your face, hands and feet. And this is because if you have protein leaking from your cells, water will follow protein. So it stands to reason that you will also have water leaking from your cells as well. And this will collect in your face, hands and feet. And just a little note that edema on its own isn't necessarily indicative of preeclampsia. It can be quite normal in pregnancy to have some swelling in your hands and feet, especially when it's warm. If you have high blood pressure, you may also experience a headache that's severe and not going away with paracetamol. And sometimes women say that they have visual disturbances, so they have blurry eyesight or like flashes in front of their eyes or things floating in front of their eyes. Any visual disturbance is a potential sign of preeclampsia. And also because you've got high blood pressure and your cells are leaking protein and they're leaking water as well, this can affect your liver function, and some women report epigastric pain, which is pain below the breast line in the liver area, and this is because your liver's working very hard. So these are the signs of preeclampsia, and if you have any of these signs, it is a good idea to call your midwife, or if your local midwife has finished for the day, then to call your local maternity triage unit for advice, especially if you're over 20 weeks. They will then invite you into the hospital. They will ask you about your baby's movements and whether they're normal. They will check your blood pressure and your urine again. They will also offer you some blood tests, and these will test your liver function, your kidney function, your blood clotting factors, amongst other things. And you will also be offered monitoring of your baby's heartbeat when you're over 26 weeks. If you were found to have preeclampsia, then your healthcare professional will talk to you about treatment. Treatment is often given to lower the blood pressure and to keep it at a normal level for you. And sometimes the blood pressure medication is enough to manage your preeclampsia. However, if your blood pressure isn't able to be managed, then your consultant will talk to you about next steps. Thank you.